Hi everyone. Sorry it's been a couple of months. My health hasn't been too great. Been pretty ill. I thought I would go through. Hold on a moment. This from British Lung Foundation. Sarcoidosis and what you need to know. Rather than me trying to explain, if I read it through in full, maybe then people get a much better understanding what it is and how it can affect people. So what I'm going to do is just read this through. So bear with me because I've got a bit of a cough as well. What is sarcoidosis? Sarcoidosis, also called sarcoid, is a condition where inflamed cells clump together to make a small lumps called granulomas. These granulomas can develop in any part of your body. They are most commonly found in the lungs and the lymph glands which drain the lungs. They can also affect your skin, eyes, joints, heart, nervous system, liver, spleen, muscles, nose and sinuses. When lots of granulomas develop in one area, they begin to affect how well that part of your body works. This causes symptoms, inflammation, which is usually reversible, can sometimes progress to scarring, which isn't reversible. Sarcoidosis affects people in lots of different ways. It can cause symptoms in just one part of your body or many parts at the same time. Though sarcoidosis isn't always a lung condition, lungs are affected in about 90% of cases. When the lungs are affected, it's called pulmonary sarcoidosis. You can get sarcoidosis at any age, but it typically affects adults in their 30s or 40s. It's not a common condition. What causes sarcoidosis? We do not know what causes sarcoidosis, but we do know it's related to your immune system behaving in a way it shouldn't. It's probably a response to various triggers in the environment. Normally, your immune system fights infections by releasing white blood cells into your blood to destroy germs. This causes the affected part of your body to become inflamed, making it swollen or red. Researchers think that sarcoidosis could be caused by something in the environment that stops your immune system working properly. Sorry about the coughing. Researchers also suggest that for some people, the risk of getting sarcoidosis related to their genes. Sometimes more than one family member can get sarcoidosis, but there's no evidence that it's infectious. Your symptoms depend on what part of your body is affected. They can include feeling shortness, short of breath, cough, which is often dry, which is what I've been having for a long time, tiredness and feeling ill or feverish, red painful eyes with impaired eyesight, painful red lumps on your shins, swollen glands in your face, neck, armpits or groin, skin rashes, painful joints, bones and muscles, abnormal heart rhythm or chest pain, sweats, fatigue that when severe can be extreme. In some cases, symptoms come on suddenly but don't last very long. This is called acute sarcoidosis. Common symptoms of acute sarcoidosis are swollen glands, fever, tiredness, joint pains, lumps or rashes on the legs. If your symptoms develop slowly and last longer, this is called chronic sarcoidosis. This means the condition is long term. People with long-term sarcoidosis may have fewer symptoms, but the symptoms can get worse over time. Some people never experience any significant symptoms. In this case, you may only discover you have sarcoidosis if you have a chest x-ray or any other reason. To apologise. It's been worse over the last week or two. Sarcoidosis can be difficult to diagnose. It shares symptoms with lots of other diseases, and you may not have any obvious symptoms. You might need to have different tests depending on which part of your body are affected. There is no single specific test that diagnoses sarcoidosis. If it looks like sarcoidosis is affecting your lungs, you probably have a lung function test, a chest x-ray or CT scan. A CT scan uses a special x-ray machine to make a detailed image of the inside of your body. In most cases, it may be enough to find out if you have sarcoidosis, but doctors will often need more information. In some cases, the doctor may want to examine the inside of your lungs more closely by doing a bronchoscopy. I don't think I pronounced that right, but never mind. This is done using the bronchoscope, thin, flexible tube with a light and a very small camera at one end. The tube A tube is passed through your nose or your mouth, down your windpipe into your lungs. Procedure ain't painful, but it can make you cough. It's often done under sedation with local anaesthetic. Your doctor will be able to give you more details. During the procedure, your doctor may take a sample of your tissue from your lungs. This can be examined under a microscope to see if there's any granulomas. This is called a biopsy, which I've had. Some I have actually had a biopsy. Some centres prefer to do this using a ABUS TBNA procedure. The doctor uses a special kind of bronchoscope with ultrasound to see inside your lungs and takes a tissue sample. This procedure takes slightly longer than standard bronchoscopy, but it is more likely to give a clear diagnosis than a standard bronchoscopy. Let's just hold on just a moment. Sorry about that. Sarcoidosis in other parts of your body. You may have blood tests, urine tests, or a biopsy of the infected area. You may also have an electrocardiogram, sometimes called an ECG. Simple test that records the rhythm of your heart. Had that recently, actually. If you're diagnosed with sarcoidosis in one part of your body, other parts of your body may also be infected. Further tests will help to show how different parts of your body are affected. Treatment. Sarcoidosis can get better without medication. This means it's normal for your doctor to keep an eye on symptoms for a few months before talking about treatment. It's usual to have regular chest x-rays, breathing tests and blood tests to monitor your condition. Many people with sarcoidosis don't need treatment, but treatment may be needed. Symptoms are affecting quality of life, which it is with me. Scarring in your organs is severe enough to be potentially dangerous. Most people with acute sarcoidosis, which is short term, won't need specific treatment. If your sarcoidosis is causing you pain, such as muscle or joint pain, painkillers as ibuprofen or paracetamol can help. I get all over body pain, so I've got to take ibuprofen or the paracetamols. Treatment for sarcoidosis aimed at improving your symptoms and preventing inflammation from causing scarring and damage to the affected parts of your body. Steroids are an effective treatment. Sometimes they can be used directly on parts of your body that are affected. For example, you can use eye drops for eye symptoms. More usually, you take them as a course of tablets. If you take high doses of steroids for a long time, you can experience side effects. These include increased appetite, weight gain, indigestion, heartburn, mood disturbances, difficulty sleeping. They can also cause thinning of the bones or osteoporosis, for this reason you'll usually take a high dose of tablets for a short time, followed by a lower dose over a much longer period. If you stop taking steroids too soon, your condition might become active again and cause more scarring, so you'll often need to continue treatment for up to 2 years. Often you only need one course of steroids, but sometimes you might need to take a second course. Only a small number of people with sarcoidosis needs long-term treatment with steroids. If you take steroids long-term, most people care centres will recommend a bone density scan. This can be repeated if you take steroids for over 2 years. For a bit of information, for other medication, very small number of people, steroids not enough to control their symptoms, or the dose needs to control symptoms in the longer term is too high. These people may need to take other medication called immunosuppressants that help control your body's immune system, such as melatotrexate, I'm not going to even pronounce some of this stuff. Yeah, so, it's it basically in Latin. Where is it? You can see it there. These are all require careful monitoring with regular blood tests and may increase your risk of infection. Some of side effects you discuss with your healthcare professional. If you have sarcoidosis, you might have a tendency to develop high levels of calcium in your urine blood. Sorry about mispronunciation there. Don't take any calcium or vitamin D supplements. They're specifically recommended for you by your sarcoidosis specialist. Should be able to get all the calcium and vitamin D you need for your diet. Stress often triggers sarcoidosis symptoms. It helps to think carefully about your lifestyle. Talk to your friends, family, or healthcare professional about how you feel and try to find ways to reduce stress in your life. And here we go. If you smoke, the best thing you can do is look after your health is to quit. Yeah, okay. Getting regular exercise and enough sleep is important. As with any lung condition, it's important to eat well and maintain a healthy weight. Find out, yeah, okay. What is the outlet? Almost finished. I'm terribly sorry about this coughing. Sarcoidosis affects people in very different ways. Acute sarcoidosis can last for just a few weeks and months. Chronic sarcoidosis can last for... I've got the chronic version because it has lasted me since 2018. It can last for years but not get any worse. Sometimes you might get flare-ups of your symptoms and need treatment. Flare-up. Flare-up is when your symptoms suddenly get worse. Sarcoidosis can affect many parts of the body, and research has shown it's possible for it to develop in places not previously affected, but usually if sarcoidosis does start, it will be in the area of the body where it first started with the same symptoms. Over time, sarcoidosis can cause scarring and damage in affected parts of your body and lungs. This will make you feel more and more out of breath. If diagnosed early, it may be possible to treat sarcoidosis and minimize damage or scarring. Most people who have long-term sarcoidosis eventually improve and can have an active life. In some cases, with long-term sarcoidosis, can get worse over months or years. Please stop. Cough. There can be permanent damage to affected parts of the body. People with sarcoidosis that affect the heart and lungs can die from sarcoidosis, but this is rare. Then it gives you a helpline. So I will show that actually, because it go into, I don't think it's gonna, there you go, UK only. At some point in our lives, 1 in 5 of us will have a lung. Yeah, okay. Yeah, that's basically it. That covers the basic information. What has recently happened to do with me is I had a flare up. It had affected my lungs. They did a chest X-ray. They found damage, what looks like damage on the lungs. I've now had to take a steroid inhaler. Hopefully that heal things. They didn't say there was any scarring. It's just that there is damage there. So hopefully at some point that will hopefully improve over time with the steroid stuff and that. Hopefully I'll start feeling better soon. But yeah, it's been tough. It's been heavy. I've been really ill, as you can see, because I've had a bit of a cold anyway. It's affected my chest. That's just, sorry, that redness is more to do with the having a shave, but you can see the actually, if you see the whiteness there, that might be due to sarcoidosis. There, I'm not sure though. So yeah, it's made me really quite ill. A bit short of breath, yeah, but coughing, a lot of dry coughing and that. Yeah, just affected my my chest, right lung, it affected, and yeah, not great. But what is weird is it usually does, not a lot of the time, affects the lungs first, but with me it affected my kidneys and raising the calcium levels that caused a septicemia, so I almost died through that. That's how it started with me. Now I'm getting all over body pain, still getting that after 4 years. It affects more, even though it's all over my body, it affects my legs, particularly the lower legs and my arms. So yeah, not great, but still, I just wanted to cover this what is sarcoidosis by using a leaflet and reading from it. I do apologise about my constant coughing, but at least the information is now on here. I've read it out. It's far better than trying to explain from the top of your head what sarcoidosis is. Better to grab a leaflet and actually read from the leaflet, and then you get a clearer picture of of this disease, autoimmune disease. So yeah, thanks for watching, and hopefully I'll be back to more to normality over the next couple of months with the doing videos. I do want to show off some of my hobby stuff and things like that. It's going to take a little while though, but hopefully we'll at some point, especially when this cough has finally subsided quite a bit, I can start making some videos again. I hope I'll start feeling better enough mentally as well to do so. But really, honestly, thanks for watching. Until next time.